Hello, my name is Vivian Garcia. I'm the Senior Marketing Manager for Product at Springer Publishing. Today, we are presenting, as you can see on screen, Empowering Diabetes Care Through Technology, the Evolving Role of Nurse Practitioners. I'd like to introduce our esteemed author, Dr. Angela R. Thompson. Second. And she is a family nurse practitioner specializing in the care of adolescents and adults with diabetes for the last 25 years. Her current clinical practice is within a hospital-based endocrinology clinic at Hendricks Regional Health in Danville, Indiana. She serves as a vice president of the Diabetes Youth Foundation of Indiana, a not-for-profit organization dedicated to educating, supporting, and empowering families and children with type 1 diabetes. So before we begin the official presentation, a quick reminder, this webinar is being recorded and will be available on demand at www.springerpub.com/videos in about 5 to 7 days post the event. If you have any questions for Dr. Thompson, please type them into the Q&A or the chat, and we will answer them later in the presentation. If you forgot to ask a question, you've still got a chance. There will be a brief survey sent at the end of the webinar, and you can include your question there. We encourage you to take the survey as it helps us create great programming for all of you. So with that said, let's get started, and I'll turn the presentation over to Dr. Thompson now.
Thank you, Vivian. I appreciate that introduction. I want to welcome everyone to today's presentation. And what we're going to do is we're going to be looking at how nurse practitioners can use technology to transform diabetes care from real-time monitoring to patient empowerment. So we're going to be looking at the current diabetes landscape, the impact of technology in diabetes care, and then the pivotal role that NPs and APPs play in advancing technology in diabetes care. So let's go ahead and move on to the next slide, Vivian. And I purposely wanted to show this picture because I think it's so powerful, and it almost doesn't even need any words to describe just how relentless diabetes can be for a patient, and the fact that it demands daily attention, and it can be really overwhelming because they're managing a full-time job. With that full-time job of managing diabetes, they don't get any weekends off, there's no vacation time, and they don't receive a paycheck. Not only that, but they're juggling their possibly other full-time or part-time job and their family and other responsibilities. So this can be not only overwhelming, but it can really it can end up having patients feel so overwhelmed that they may end up giving up. You see a lot of patients that may not be as engaged in their diabetes management. They may be falling short of meeting their glycemic goals. And so this is where we can integrate technology to try to improve outcomes. Patients living with diabetes also have problems with, they have few touch points with you as a provider in between visits. They may see you 2, 3, 4 times a year. And essentially what that means is most of the management falls on that patient, that day-to-day management where they're making critical decisions about their care and medication management and lifestyle choices. And this is where, with the integration of technology, we can try to bridge the gap in between those visits with you, and we can try to support and better connect those patients, not only with you as their provider, but also day to day, so that they have definitely feel more empowerment in managing their diabetes. And you're in a perfect position to do that as a nurse practitioner. So go on to the next slide, please. Traditional diabetes care, I don't know if you've noticed, but I definitely feel like it falls short in helping meet the comprehensive needs of our patients. As you can see on this slide, there are several notable gaps that persist with traditional care models. We certainly have it impacting the effectiveness of disease management, and it affects the overall patient well-being. So we have a fragmented healthcare system. You all know that. Those of you who have been practicing for quite some time understand that there are definitely health inequalities and access issues that continue to persist. There's inadequate technology and resource support within our practices. There are definitely increased demands to see more patients during the day, which can lead to work overload. Certainly is related to burnout that providers feel. And it also leaves us with a really limited time with being able to engage and interact with our patients, including being able to provide education. Move on to the next slide, please. But the last decade, what I have been really excited about is the digital health shifts that have occurred. In particular, were occurring before COVID-19, but certainly COVID-19 changed the landscape. Telehealth became not only an option, but really the only option for a short bit in being able to connect with our patients. And in 2020 alone, there was a 63-fold increase in telehealth visits, and that remains pretty high today as well. So telehealth is, it's no longer just an option for care. Our patients are actually asking to be able to have virtual options, to be able to connect with us as providers. They're asking about wearable devices. They're asking about mobile health apps. And even some of them are looking into AI options and some of the available tools out there to help them make better decisions in their diabetes management. And we need to really meet our patients there. So for those of you who are quite uncomfortable or somewhat uncomfortable with integrating technology, I feel your pain. That's where I was at when these options for technology came out and I started integrating them into my practice. But there are definitely tools and support available for you. And that's what I'm hoping today I can help guide you there. The digital innovations that we're able to offer to patients can definitely help them, help us as NPs meet the expectations. But at the same time, it gives an opportunity to improve outcomes. And you'll be surprised at just how much that changes within your practice as you're able to integrate tools. So let's go into the next slide, because I want to be able to show you some of the technology options and what the main drivers are that are reshaping our diabetes management. Each of these types of technologies adds data, precision, and convenience. We've got, of course, the telehealth visits, which have given us an opportunity to reach patients that previous to telehealth visits would have been had to forego care because they don't have access. They may not have transportation to attend visits. They may be very far away from where your office is located at. So in addition to that, we've got continuous glucose monitors that are offering real-time feedback and alerts for our patients and for you as a provider, as well as having integration with apps and with phones and with you as a provider. There's sharing options. There's sharing options for our patients to be able to allow their family to be able to become more involved in their diabetes management and help support them. We also have smart pin options and insulin pumps. Not only have they improved accuracy with delivery, but they also offer real-time data and feedback and automation even in delivery with the integration of AI. Additionally, along with smart pens and CGMs, insulin pumps have data sharing options for you as a provider and sharing for family members. Then we've got mobile apps with digital coaching. Those include things like Calorie King, My Sugar, Under My Fork, Happy Bob, Sugar Mate. So I just wanted to name a few of those. And I've got two of the apps listed on the screen. You've got the image for the Calorie King, which is a huge database that allows your patients to be able to look up not only calorie counts, but also macros and carbohydrates. It's got an extensive database. But then you also have the option to use My Sugar, which allows them to track, they can log their carbs that they've consumed, their insulin that they've administered, their activity, their glucose levels, and it's all electronic. So these various software and apps provide a lot of support for our patients. And then you as a healthcare provider can help you get better support and aid in those conversations that you'll have with your patients about the clinical decisions that they're making daily. They allow data tracking, they have reminders, and some of them even have AI coaching built into them. You've also got digital therapeutic software, which is completely different than mobile apps. The digital therapeutics that are available, I'll name off a couple, are Blue Star, Insulia, or D-Nav. And these are FDA-approved software options that you can use to provide insulin dose calculators for your patients, but also decision support systems for you, because they help you as a clinician with titrating or adjusting insulin, primarily basal insulin, but there are some that are now starting to integrate bolus insulin adjustments. And then finally, you've got AI, right? We've got AI driving feedback and also for use with predictive analytics. So AI is now starting to be embedded in some of these tools. And not only are they being used to detect risk patterns, but they're also being used to personalize treatment planning. And all of these tools combined reduce guesswork from the patients and guesswork for you as a provider. Next slide. And now there's a significant amount of evidence that is supporting the use of diabetes technology as a means of improving outcomes. There are tons and tons of studies that have shown that utilization of continuous glucose monitors, insulin pumps, with integration or without integration of CGMs, as well as some of the apps, reduce A1C levels up to 1 to 2%, depending on the study you're looking at. There's a significant reduction in hypoglycemia with the use of these tools. There's an increased time spent in the healthy range. There is a reduction in variability, so those wide swings that you can see in individuals with their glucose levels. Not only that, but they tend to improve adherence. They have improvements in satisfaction scores when there have been studies looking at patient satisfaction with the use of these tools. There's also been a reduction in diabetes distress, which is really important when you're dealing with patients, that you're monitoring their diabetes distress and the impact that diabetes is having on their day-to-day overall health. And then there's a reduction in hypoglycemic fear, which that is one of the #1 drivers of not being able to meet outcomes, is the fear of hypoglycemia. It is very limiting and restricts the patient and your ability as a healthcare provider in moving forward with trying to improve their overall glycemic management. And then a study that I wanted to share that I am so proud of, not that I was involved in it, but just because of what it showed, was there was a meta-analysis in 2023 that looked at patients who were receiving care from NPs in a digital diabetes management program. And in that study, it showed fewer hospitalizations and higher efficacy, self-efficacy with patients, reports of self-efficacy. And so I think that's huge to see where nurse practitioners are definitely leading in technology and what outcome data or what outcomes are being shown as a result of that. So when NPs, my summary of this is when NPs interpret this data and guide patients, the impact can absolutely be amplified. And then next slide, let's go over some of the guidelines. ADA's 2025 guidelines, and even actually 2023 and 2024 has supported the use of diabetes technology in the management of diabetes. The recommendations specifically are to make sure that you as a provider that you're offering diabetes devices for individuals with diabetes, that you're looking at connected pens for people that are on multiple daily injections, and or the option of having an insulin pump and continuous glucose monitor to help with decision making and giving more precise doses than what can be offered by injections alone. And that you're considering even combination therapy that has online or virtual coaching, since that absolutely can help our patients in between appointments with some of the decisions that they make about their lifestyle or their medication management. And next slide. And this is where nurse practitioners, we as NPs, we can bring a perfect blend of compassion and practicality to tech adoption. I think with our unique strengths, being holistic care, education, we're great educators, and then we're more accessible, that we can bridge the technology with the human connection. We're in an ideal position for this. We educate, we advocate, and we individualize care. We shine in those areas. Our teaching role is where, we need to continue to embrace that, and we need to turn data into dialogue, because that really means empowerment. Empowerment for our patients and empowerment for you with integrating technology in your practice. All right, next slide. So it's my belief that with connected data, we can make decisions faster. We can improve outcomes for our patients, as I already indicated to you, that is something that is gleaned from the integration of diabetes technology. We need to teach our patients how to interpret continuous glucose monitoring data. We need to, with our patients, review their glucose patterns and try to match what's happening with their lifestyle and with behavior, make those connections for the patients. We need to be basically, we need to use self-management or integrate self-management goals with technology and use that as a guide in between visits and at visits to be able to integrate these devices. You also want to make sure that you have some form of EMR or EHR tracking so you can monitor trends and evaluate the progress over time to see just how successful the patient and you are with reaching self-management goals. And if there are barriers to reaching those goals, you have the opportunity to identify those and start working on those and set a new goal with the patient. So it allows you to proactively intervene. You have the ability to make adjustments with the patients during their visits, also through telehealth and with electronic messaging. I think that when NPs and patients have access to real-time data, that's when care becomes proactive rather than reactive. It's going to allow us to, or at least it's allowed me, and there's data to support. And I think this will happen with you once you start integrating technology. You'll be able to evaluate trends. You can stop hypoglycemia before it happens, before it becomes an emergency, with real-time alarms in the continuous glucose monitoring, with predictive patterns and automated adjustment in insulin that occurs with these insulin pumps that have integrated CGMs. And then you'll be able to adjust, whether it be weekly, bi-weekly, monthly, medications, change behavior in between appointments, rather than waiting 3 or 4 months later when you have an office visit. You make progress much faster. All right, next slide. That doesn't mean that it's simple. Those of you who have not been able to integrate technology into your diabetes management, it's for a reason. It can be really daunting trying to figure out what technology to integrate and then how to do that. So I wanted to take a few moments to go over some of the steps that I use to integrate technology into my practice. This is not necessarily a guideline. This is really a clinical pearl for you. So I'll give you an example. Continuous glucose monitors. When I first started utilizing those in practice, I needed to really select. Well, first of all, I needed to determine which technology I wanted to integrate at a time. I in no way integrated CGMs, apps, pumps, AI tools, digital therapeutics all at the same time. Way too much. Pick one technology that you feel would most benefit your patients, or you could integrate the technology that your patients have requested the most. So start there. So when I integrated CGM, I selected CGM because I felt like that was the most powerful tool I could offer to my patients to improve outcomes and reduce hypoglycemia. I learned everything I could about the available CGMs. What are available by prescription? What are available over the counter? How are they different? How are they similar? Then I looked at coverage. What does Medicare cover? What does Medicaid in Indiana, because that's where I practice, cover? What about commercial insurers? Do they have formulary preferences? So I was prepared on what I could go over with my patients at their appointments, and I would select the tool based on not only patient factors, do they need a more simple CGM? Do they need one that's less costly because they have a high deductible plan and it may not be covered by, it's not covered until they meet their deductible. So those types of scenarios. And I wanted to make sure I selected the right patient because not all insurance covers CGM for individuals unless they're on insulin or having frequent hypoglycemic events. So, those individuals that don't meet those requirements, they're going to not be able to utilize the devices or, like I said, pay out of pocket. Then I provided education to the care team. That includes my front office staff, my back office staff, helped define what their roles would be. Who's going to obtain those devices, or who is going to download those the data from the sensor, and then who's going to initiate training or support training in troubleshooting. How is the data going to be obtained in between appointments? And let me get a drink really quickly because I've got a little bit of a cold. So I defined clear roles and then the workflow. Then you want to develop your management plan. Are you only going to look at the data at visits? Are you going to look at the data and make changes in between visits? Who do you want to do that with? Is it only those you're initiating insulin? Is it those who are not meeting goals, and so you're trying to help them meet goals in between visits, and so you're downloading the data and having discussions with them, whether it's a telehealth visit or electronic messaging in between appointments. And then of course, I talked about, the coverage and reimbursement options. Well, I didn't talk about reimbursement. I talked about coverage. Reimbursement, you want to make sure you know what's reimbursed, what's not reimbursed, and the codes associated with that. And then you want to get all of your resources for the technology, for the patient, for you, for your staff, and then make sure that you have a plan on how that education is going to go with the patient. So let's move on to some of the barriers that you are likely to encounter with integrating technology. So the challenges are real, but they're absolutely solvable. I think the NP role is the key to really translating technology into everyday usability. With digital literacy, what I have found most helpful, and there is some data to support this, but I can tell you what I have found helpful in integrating it is those individuals who you may not associate with the digital technology, like somebody who might have low literacy, who might have, the elderly who have not really adopted technology at all. They're still using flip phones or home phones for that matter. They're not excluded from the use of technology. They just need a lot of one-on-one coaching, and they need multiple episodes of training and support in between appointments. They also need the ability to get education in more than one format. So demonstration, return demonstration, reading materials, all of those are going to be needed to help them succeed. With the cost, there are some assistance programs out there available for CGMs if an individual is uninsured. You also want to, though, avoid non-formulary prescribing, because if you prescribe off formulary, then it is going to cost more. So make sure you know the formulary options for the area that you work and live in. And then ensure eligibility requirements so you don't get a rejection or high costs associated with them not meeting the criteria. With data overload, really what I recommend for that, because you are going to get a lot of data and you may not know what to do with it, that's where you want to make sure you're focusing more on trend data, not every particular number. The only exception to that is if you have an outlier, you have maybe an individual who's had significant hypoglycemia that occurred, say, on a Monday in the morning, and it required outside assistance from like a family member to treat, then you do want to focus on that outlier, trying to determine what events occurred before that could have been possibly the cause or a contributing factor, so that you can mitigate that. And then you also can get a lot of support from the companies that promote these products so that you can help, what metrics to look at and how to use that data over time and teach the patients. And then the complexity, that leading into the complexity and the burden of technology, having proper education for yourself and training and support is essential. And then also having that for your patients and for those in your office. And so you can leverage those resources. You can also leverage, if you have access to a CDCDS program, they are wonderful to be able to help provide education, training, and support to patients. If you're unsure if you have access to CDCDSs in your area, both the ADA as well as the ADCDS have the ability to look up education programs that have trained CDCDSs working in them. And then you're going to have a little bit of problem sometimes with the stress of the devices, with troubleshooting the devices, with fielding those questions from your patient. And so having education again and training on, what those things are. So like interferences with glucose sensors. If somebody is having a discrepancy between the sensor and the blood glucose monitor, or if they're having problems with it staying on, knowing what tools and strategies are available for that is really important. These practical strategies, because they're going to help you close these gaps, these barriers. They're going to offer you the solutions. And then lastly, next slide, here's a list of some of the technology resources that are available for U.S. providers. And to some degree, there are patient education materials on some of these sites. So although this is not a complete list of resources, these will absolutely help you get started, and they will be your go-to ongoing to help stay abreast of technology advances in diabetes care. So with that, I am going to open it up for questions and answers. I know that my helpful partner, Veronica, I think, or Vivian, was looking at some of the questions that you guys were putting in the chat. And so let's take some of those questions. I'm ready for them.
Excellent. And yes, just a reminder, feel free to put questions in the chat or to enter them in the Q&A box. I'm going to give a second here. Just navigating the controls here, so just give me a second. And give folks a little bit of time to enter their questions. Second, okay.
I feel like we need some music playing.
I know, like a Jeopardy theme song, maybe. Well, I did want to share one comment, which was Not a question, but I wanted to say thank you to Dr. Thompson for her leadership in this arena, as well as with NP practice and policy. And that's from Valerie Fuller. So I
Oh,
wanted to share that
thank
lovely
you,
news.
Valerie.
Okay, so I got a question. How has AI influenced the technology of diabetes treatment?
So I would say the most valuable tool available using AI right now, because there's more in the works, is the insulin pump automation and integration with continuous glucose monitors. So the algorithms that are built into the insulin pumps are such that they monitor actually trend data. So they look at the current glucose, the glucose levels preceding the current glucose, and they have predictive analysis, so they can predict where the glucose level is heading. And based on those factors, as well as if a patient's put in a blood glucose level, or if they've put in their carbohydrates that they're consuming, it can give advice on how much insulin to take. And so it's based on so many factors that the precision associated with it is just, it's amazing. It's amazing how much improvements. I mean, I've seen some of my patients that are using these integrated pumps with CGM technology. I know that the data that has come from evidence-based research studies show like a 1 to 2% drop in A1C, but I've seen 3 and 4% drops in A1C, and I have seen hypoglycemic episodes go down dramatically to like 1%, if at all. I mean, sometimes it mitigates all hypoglycemia.
Next question. How long does it take to get the diabetes certification?
So diabetes certification, it depends on which one you're talking about. So there is a CD/CDS certification, which is focused on education, educating your patients and supporting your patients. And then there's a board certification in advanced diabetes management, which is a BCADM. And so they each have their different eligibility requirements. So as a CD/CDS, you do have to be a professional licensed individual, but that could be a registered nurse, a registered dietitian, a pharmacist, a physician assistant, a nurse practitioner. With the board certification in advanced diabetes management, that's a higher level of education. So a master's prepared or doctoral prepared education is a requirement for that. And then there are so many hours that you need to spend either educating your patients or managing your patients with diabetes. So there's clinical hours attributed to being able to sit for the certification exam. And so I would encourage you, depending on which one you're looking at, I would encourage you to go to right now, it's all of the certifications have been moved over, integrated into, one of them was housed with ADCES, and the other was housed with I think it's like the American Diabetes Certification Association. Vivian, do you remember the exact name? I can
I
probably
did not,
send, I
unfortunately.
can actually look that up really quickly and put it in the chat.
Oh,
Um,
okay.
sorry, I've been certified for like 20 years. So, and they've gone through some changes, but I'll put that in the chat here in a second, like what website you would go to look at certification. But I would say you'd probably be looking at a minimum of 2 years to be certified for either one of those. And I have certifications for both. I started out as a CDS, and then I obtained my education in training to sit for the BCADM. So, and while you're navigating some questions, I'm going to look up really quick the
Sure. So I'll give you your next question in the meantime. How is real-time data from devices like continuous glucose monitors influencing clinical decision making?
oh, it absolutely informs clinical decision making. When you're looking at blood glucose monitoring, and I've really been able to appreciate this over the years because, I started practicing in diabetes back in 2000. That's actually when I started. And so it's really changed the technology options available. At that point in time, blood glucose monitoring was what we had, and it was wonderful, especially because we had the ability to integrate it, into our EMR systems, and it gave us trend data. And then when continuous glucose monitors became available, I saw just how much data I was missing and how the decisions I was making, although they were the best that I had available to me, I would make different decisions if I had had continuous glucose monitors because it fills in the gaps. You have every minute of every day what their glucose levels are. And so you can really be able to see, what happens from point A to point B. Whereas with blood glucose monitoring, you just see point A and point B. You don't really know what happened in between, which can be very critical in how you would make your decisions. So I'll give you a really quick example. Oftentimes with blood glucose monitoring data, when we see patients' glucose levels at bedtime are 90, and then in the morning they're 250, naturally you would think, well, if they're on insulin, they need a higher amount of basal insulin, right? We need to increase that. Well, not necessarily, because what often happens is that they can become hypoglycemic at 2 or 3 in the morning, then have treated that, sometimes overtreated because hypoglycemia feels horrible and they want to eliminate those feelings as soon as possible. So oftentimes they're eating like way more than they should to correct it. And then their glucose levels are really elevated in the morning. And so if you raise their basal insulin dose, you're going to cause more hypoglycemia and worsening of that fasting glucose elevation. When in reality, what you need to do is look at what happened before that. If they were on mealtime insulin, was it that pre-meal or pre-dinner dose that needs to be adjusted down? Are they on a sulfonylurea? So maybe that needs to be adjusted. Do they need to have a snack at bedtime to prevent that from happening? And then there's no medication adjustments. So that just gives you a real example of how it's changing clinical decision making.
And I know you were looking up that information for the certification. So I think we've got time for one more question, which is, how would you handle a patient who is resistant to using technology? Oh, you just muted by mistake, I think.
Oh, sorry
There
about
you
that.
go.
I think when I was going to look up the resource,
Oh, yeah, got it.
and I put it in the chat, it muted me automatically. So apologize for that. So you got to meet patients where they're at. Oftentimes it's fear associated with technology because they're not utilizing technology at all in their daily life. They just don't. They don't have smart TVs. They don't have smartphones. They're not using apps. And so, I usually just talk to them a little bit about the benefits, tell them about how I'm going to support them in that decision. Sometimes I'll offer them a sample CGM. So you can get samples from the manufacturers of at least Dexcom and Libre. So I tell them, let me go ahead and insert this today. You don't have to do anything, you wear it. And then we're going to come back in. I'm going to have you come back in about a week so that we can look over the data, because I want you to be able to see what your glucose levels are doing. And then let's look at your medicines and let's see if there's any opportunities to be able to help improve the glucose levels. And then they can look at the data, but I tell them not to act on the data. So that's one way that I handle it. If there is fear associated with not having control of their diabetes, because that's sometimes what they fear, is that it's taking away what they've always known, and they don't like change. I sometimes um, offer the same strategies to be able to integrate it. I allow them to be kind of a passive observer. Or I will accept that they are not interested. They're not ready at this time, and give them some links, that they can use to look up the information, have them talk to family and friends about it, and just give them an opening. If you're ready for it, if you're interested in it, then just reach back out to me.
Excellent. So take a moment. And I wanted to thank you, Dr. Thompson, so much. Thank everyone for joining us today, but thank you for the great presentation. And then you'll see on screen, if you're interested in purchasing Dr. Thompson's care and management of type 2 diabetes in adults, or any other products in celebration of NP Week, you can use the coupon code NP Week for 25% off through November 16th, which is this coming Sunday, on springerpub.com. And you could also use a QR code if that's easier for everyone. And the other thing I wanted to share is that we will be having webinars every day this week at 12 p.m. Eastern. So if you like this session, I'd encourage you to visit blog.springerpub.com and sign up for the others. So the other fun thing to share with everyone is that any attendees of today's session will also receive a free gift from us. And it's a featured chapter from the Guide for the New Nurse Practitioner Transitioning into Practice. And the chapter will be all about finding your professional home. And you'll receive that in an email following the webinar. And Dr. Thompson, was there anything else you'd like to say before we sign off?
I just have one more thing to say. For those of you who are still uncertain about the integration of technology, in my book, I have an entire chapter on how to integrate CGMs and insulin pumps and apps. Very detailed, practical applications for that. So not that I'm kind of plugging my book, I guess, but I also, that is another resource that you have available to you that you can use.
Thank you so much, Dr. Thompson. And a lot of the chat are thank yous from our participants. So again, thank you, everyone. Have a wonderful rest of your day. And don't forget that we've got a little survey that'll go out after the webinar. Please fill it out if you have the opportunity to do so, as it helps us with all of the great programs that we could do here at Springer. And have a great day, everyone. Thank you.